Community reintegration is a simple yet powerful idea. It's about helping people return to their lives after an injury, illness, or significant life change. Think of it as rebuilding the bridge that connects a person back to their world. This isn't just about leaving the hospital or clinic, it's about rejoining the fabric of everyday life. It means going back to work or school, shopping for groceries, meeting friends for coffee, even joining a local walking group. Reintegration is about reclaiming roles, routines, and relationships that give life meaning. Disconnection can lead to loneliness, depression, and anxiety, stalling recovery. As OTs, we guide clients past fears and barriers, back into community with confidence. The first step is to start small. Grand goals can overwhelm a vulnerable client. Focus on small, manageable wins that build confidence. Begin with a conversation. What do they miss most? A coffee at a favorite cafe, a visit to the library, or a walk with their dog? Choose one personal goal, then break it down. Plan the trip. Pick a quiet time and map the route. Decide how to get there. Walk, drive, or take public transport. Rehearse in parts, ordering, paying, and carrying a drink to the table. Use practice and role play to problem solve together. Apply graded exposure, brief entrance, then one aisle, then a single purchase. For sensitivity to noise, start quiet, then build to busier settings. Community reintegration is not a one-time event. It begins a new chapter. Weave health promotion into everything. Enable people to take control and improve their health. Move beyond treating illness. Equip clients to cook nutritious meals, stay active, manage stress, and prioritize sleep. After a cardiac event, clients need more than modifications. They need stress, movement, and food strategies. This isn't generic advice. It must be tailored to the individual. Support realities. Low-cost recipes for a single parent, Tai Chi or swimming for chronic pain. Instead of saying exercise more, co-create a weekly walking plan around their schedule. Modify environment so healthy choices are easy. Pantry and sleep sanctuary. Use pacing to preserve energy for meaningful action. Small, consistent changes build long-term well-being. The journey of reintegration, supported by health promotion, rebuilds lives, not just bodies. We start small, we break it down, we use graded exposure, we connect clients to their wider community. This blueprint empowers people to reclaim their place in the world. Lasting success rests on well-being. Health promotion is integral. Your role expands from therapist to health coach and connector, support that endures beyond sessions. Progress is maintained and continues to grow. You see the bigger picture: health, environment, daily activities, and craft creative solutions. Never underestimate your impact, restoring dignity, confidence, and belonging. Take action today. Help clients unlock their full potential.